Hi, this is Dr. Evan Chait, the co-founder of Kinetic Physical Therapy, and welcome to our Kinetic Rehab video series. In this series, you're going to learn different exercises to perform at high levels so you reduce pain, decrease symptoms, and live a functional life. I'm going to give you simple ways for you to exercise at home with bands, exercise balls, chairs, staircases, you name it. Welcome, and hopefully you enjoy the series. The next stretch or mobilization technique I want you to perform is the lacrosse ball to the quadratus lumborum or the QL. Very important with this, the lacrosse ball goes to the lower back, and then from here you want to find a tender spot. The moment you find a tender spot, you want to cross the left leg, if the ball's on the left side, over. That's going to flatten out the spine. Fish around, find that tender spot, breathe in, breathe out, breathe in, breathe out. Repeat the breathing 2 more times. I want you finding between 3 and 5 tender spots in that muscle. Now the key here is not to be on the bone. So if you're on the center line of the spine, you're going to be on the bone. You want to be off center line, so you're more into the muscle or the fatty aspect of the spine. I'm going to roll over and show you where I want you to be. I don't want you here. I want you more here. Not here, more here. Again, like everything else, it's going to be painful while doing it. However, if the pain persists following, make sure you speak to your PT. This one's going to be very difficult to do in sitting and very difficult to do in standing. So lying down on your bed, your mattress might be the best place to do it on. However, it's going to be a soft surface, so you're not going to be able to get as much of the release as I want you to. The next exercise we're going to do, or mobilization technique we're going to do, is lacrosse ball to the posterior hip. Now the key with this is this could either be done sitting down on the floor, sitting on a chair, or on the bed. The bed is going to be least effective because the bed is typically very soft. Take the lacrosse ball, put it into the posterior hip. Posterior hip is also the glutes. You want to massage the glutes out. Now if you look at my body posture, I want to rotate my knees over to that left side where the ball is. I want to find tender spots. Every tender spot I find, I want to hold it and I want to breathe for 4 breaths. Breathe in, breathe out, breathe in again, breathe out, and you're going to repeat that 2 more times rather. You want to find another spot, 3 to 5 different spots in total, and do the same exact thing again. Now the key with this, it's going to be sensitive in the glutes. And if it gets too easy, what we could easily do is cross the leg over and do the same concept and breathe in through it. Now, as with everything else, if the pain gets worse following this exercise, make sure you speak to your PT. The next soft tissue mobilization technique I want you to do is lacrosse ball to the gastroc, or the calf. You could be doing this in sitting, you could also be doing it lying down. Now the key is this. You want to put the ball underneath the calf. And if we chunk out the calf into 3 different segments, inside part of the calf, outside part of the calf, and then in the middle part of the calf, that's where I want the ball to go. So you're going to find a tender spot. Once you find a tender spot, you're going to cross the right leg over the left leg. Now this is going to be pretty sensitive. Again, you want to hold this here for about 4 breaths. Breathing in slow, exhale slow, inhale slow, exhale slow. Then find another spot. Now if we chunk out the calf into 3 different compartments, outside, inside, and in the center, you want to find 3 to 5 locations in each part of the calf. This is going to be sensitive as well. Now if you have a rolling pin at home, You could use a rolling pin at home and you can massage it like this as well. And this can be done in sitting, so you don't have to get on the floor. This makes it much easier for you. In this one, we don't necessarily have to hold so long, but what you want to do is find the tender spot and just roll over it. Next spot, roll over it. And if you can watch my angle change, so this was the outside part of the calf, that's the inside part of the calf, then this will be right in the center line of the calf. And as with every other soft tissue mobilization technique and exercise we described so far, if you have pain with any of these, afterwards, please speak to your PT. The next stretch I want you to perform is the active hamstring stretch. 3 directions. You can do this on a chair, you can do this in sitting, or you can do this in a staircase. With this, from this position, I want you to put your foot up on maybe 3 to 4 stairs, or on a chair. From here, pull the toes up towards you, so you feel a stretch into the hamstring. From this position, you can rotate the foot in and rotate the foot out. Ideally, you want to be holding on to something surrounding you so you don't lose your balance. As I'm rotating the leg in and out, I'm going to repeat that 10 repetitions. When I turn my foot in, I'm going to feel more of a stretch on the outside. When I turn my foot out, most people don't feel much. Now I go lose my balance. Most people don't feel much. However, the stretch when you turn your foot in, we're actually stretching the sciatic nerve. Rotate in and out. The next position of the stretch is actually rotating to the side that your leg's stretching. So if I rotate my torso this way, where's that beam? There we go. I'm able to hold on to something, very important, and you can rotate the foot in, rotate the foot out, rotate the foot in, and rotate the foot out. 5 to 10 repetitions of each position. Next position we're gonna do is rotate away. So if I'm rotating this way, I'm still gonna rotate my foot in and out as I'm maintaining that stretch. Another critical element of this is make sure your posture is nice and tall. A lot of people typically try to roll forward and they think they're getting a stretch out of the hamstring when all they're doing is actually stretching their back out. Chest up nice and tall, rotate in, rotate out. 5 to 10 repetitions of each. Please do this in a staircase so you have something to hold on to, or a chair so you can hold on to something that for surrounding purposes so you don't fall. Again, repeat 5 to 10 repetitions, make sure you're breathing. Any pain associated with this, modify the depth of the stretch. If the pain persists, stop and call your physical therapist. Thank you. The next stretch I want you to do is called active hip flexor stretch, 3 directions. Now we could do this in a staircase, and I'd recommend you doing this in the staircase so you have points of contact with your hands. You're gonna place your right foot up. You're gonna turn the back toe slightly in. Not too far, but slightly in. You don't want the toe turned out. Turn the toe in. From here, I want you to separate the hip from the abdominal wall by doing this. You're gonna bring the hips forward, and you're gonna go back. Hips forward. Now this is different than a static stretch. Active stretches, we're only holding for about 2 seconds. You're gonna come forward, the knee is straight, tighten up your glutes, and then you're gonna go back. You're gonna do that about 5 to 10 times. Then we're gonna add an arm change. I want you to raise the arms up. So now we're opening up the front part of the hip even more. Up and back. Up and back. The next position I want you to do, if you can imagine if you're on a staircase, here's a railing. Come forward and back. Forward and back. Next position, rotating towards the down leg. Forward and back. Forward and back. It's important that you stay relaxed and you're breathing through the movement pattern. So if you can imagine, inhale as you come forward. Exhale, going back. Inhale, because we're expanding as we inhale. Inhale. Exhale, back. Same thing with rotation. Inhale. And exhale as you go back. perform 5 to 10 repetitions. You want to feel it into the front part of the hip. You might feel a little bit into the front calf of this leg, that's okay. If you have any back pain, tightness, or restriction, turn the toe in a little bit more and focus on squeezing the butt cheek of the down leg just a little bit more. And if there's pain still, make sure you speak to your physical therapist. The next exercise I want you to perform is called an adductor squeeze. Now from here, what I want you to do is put a ball or a pillow between your knees. Arms are going to be up, palms out. From this position, you want to relax your spine, squeeze the ball. Hold it for 10 seconds, but you don't want to squeeze 100%. You want to squeeze between 50 to 80%. Squeeze, inhale, exhale, inhale, exhale, and keep on breathing and squeezing for 10 seconds. You're going to repeat this exercise 10 times. So it's 10 times 10 seconds. And as with anything else, if there's pain induced with this exercise, stop it, decrease the amount of force you're putting into the ball or pillow, or if the pain still persists, stop the exercise and speak to your physical therapist. The next exercise is called supine adductor squeeze ball bridge. So from here, you're lying on your back. A ball or pillow is between your knee. You're going to squeeze the ball. As you're squeezing the ball, your arms are rolled out so your chest is open. From here, you're going to lift your butt up, squeeze your butt cheeks together, keep on squeezing the ball, and come back down. What you don't want to do is squeeze the ball, lift the butt up, and release the ball. You want to keep the constant tension on the ball the whole entire time. And then come back down. Squeeze again, back up. Now we want to focus on tempo, so you want to go really slow. 5 seconds up, 5 seconds down, and the rep range is from 15 to 25 repetitions. And as with all the other exercises, if there's pain with this, don't go so high or don't squeeze the ball too tight. If the pain still persists after this exercise, speak to your physical therapist. The next exercise I want you to perform is called the squat technique. Now you want to first make sure there's a chair behind you, so if you sit down, you don't fall. You're going to sit back, arms come forward, and you're going to come back up. A couple of key elements. You don't want your toes turned out too far. I don't mind a 10 or 15 degree turnout, that's okay. But you'll notice, because your hips might be tight, your calves might be tight, you might squat like this. I want us to avoid that. Make sure the toes are forward. You want your knees bowed out just slightly, not like that, but just slightly bowed out. You're gonna sit back, touch, and come back up. Like all the other exercises we've been talking about, you want to go nice and slow with the tempo. So 5, 4, 3, 2, 1, 1, 2, 3, 4, 5. Now what you don't want happening is this. You don't want to have a muted hip. You don't want to come down and come back up and stay here. You want to make sure you get through the hips, body's nice and tall, squeeze your butt cheeks together. Sit down again, 5, 4, 3, 2, 1. Back up, 5, 4, 3, 2, 1. Squeeze your butt cheeks, nice and tall. If there's any discomfort or pain, what you can do is put a foam book, raise it up slightly so you're not squatting as deep. If this is too easy for you, you can find a doorway or a beam and you can slowly work your way down deeper. Same tempo, and then you can eventually progress to no beam, sitting back and hanging out, and then coming back up. And if you notice, my feet had to turn out slightly, that's okay. You don't want them going out like that. Again, if there's any pain or discomfort, modify the depth. If it's too easy, modify the depth. And if there's pain, still, make sure you contact your PT. Thank you. Now that you watched all the videos, you see how simple and easy it is to perform your home exercises at home. You can come back and review these exercises on a daily basis. We want to make it very simple and easy for you to follow our programs at home so we can maximize your results in the clinic. Hopefully you guys enjoyed. I really appreciate your time and your patience, and God bless and Godspeed.